Hello and welcome. In this video, I would like to cover two of my most favorite topics in the whole world of obstetrics and the things that I think are probably the most important thing for you to learn as new parents, and that is skin to skin and breastfeeding. So because humans are mammals that walk upright, our pelvic outlets are a lot smaller than other mammals. And human babies' brains are a lot bigger than other mammals' brains at birth. So because of this, human babies have to be born a lot sooner than other mammals. Human babies are actually designed to spend a fourth trimester skin to skin on mom's chest, where they're getting protection, warmth, and nutrients. All mammals get separation anxiety when they're separated from their mom. And when they're having this anxiety, they are releasing cortisol and dopamine, which are stress hormones. When an infant is stressed, they're not going to focus on nutrition. They're focusing on regulating their vital signs. But when a baby is skin to skin, their vital signs are more easily regulated naturally. Skin to skin supports cardiopulmonary stabilization, so regulation of the respiratory effort and cardiac function, as well as their temperature, keeping them warm enough. Skin to skin also helps babies keep their blood sugar up, which is super important to provide enough nutrients to the brain. So right after your baby is delivered, they'll be placed onto your chest and a nurse will stimulate and dry them with a towel or a blanket. And this is important because when the baby is in the uterus, their lungs are full of amniotic fluid, and these nice strong cries at birth help push that fluid out and fill the lungs with air. So as long as your baby is having some nice strong cries at birth, they should be able to remain skin to skin with you. And this starts the beginning of the golden hour. So if you haven't heard of the golden hour, I highly recommend looking it up. It's such a beautiful concept. And really it's all about your baby learning how to regulate its vital signs in that first hour after birth, getting used to life outside the womb. And studies also show that if a first initial breastfeed is achieved in that hour, that the baby has higher success rates with breastfeeding throughout the first year of life. Skin to skin also nurtures the perfect environment for bonding between the caregivers and the baby. The baby really experiences life through sense of smell, touch, and hearing. So when they're skin to skin, they're able to smell their caretaker very well and hear their heartbeat and also feel their warmth. And when they're in this protected environment, they don't have to fight to stabilize their vital signs as much. Skin to skin also releases oxytocin in both the parents and the child, and oxytocin is such a beautiful hormone. It's nicknamed the love hormone. It initiates bonding between the two and also lowers stress hormones and helps mom's milk come in and in higher quantities. And it also helps her uterus contract back down, which prevents excessive bleeding. So really those are just a few of my favorite benefits of skin to skin. And you want to do skin to skin also anytime that you are feeding the baby. So this helps support breastfeeding by keeping the feeds longer and also helps mom's milk come in more fully. But also if you are formula feeding your baby with a bottle, skin to skin is just as important. So I really encourage parents to still unswaddle the baby and do skin to skin time every 2 to 3 hours, just as a breastfeeding baby would. If I come across a baby that's really fussy, usually the first thing that I will do is put them skin to skin with mom, because 9 times out of 10 that's what they want, and they're fussy because they're experiencing that separation anxiety. Skin to skin is also the perfect recovery position for a baby. So if they're having a little bit of pain from the delivery or anything like that, skin to skin is the perfect place that they want to be. And I really encourage parents or other caregivers to take turns doing skin to skin. It's just as important that the other parent does it as well as mom. One important thing to note is that if everyone in the room is sleeping and really tired, then the baby should be swaddled and placed in the bassinet for safety. So my other favorite topic to talk about is the benefits of breastfeeding, because I think it's so important and it's single-handedly probably the best thing that you can do to encourage the health and well-being of your new baby, and it's completely free. So it is true that getting breastfeeding started and getting through the learning curve for both you and the baby can be a little steep in the beginning, but I promise you it's so worth it. Studies actually show that at 6 months of the baby's life, that moms who are exclusively breastfeeding report less rates of exhaustion than moms that are exclusively bottle feeding. And a lot of that has to do with breastfeeding being immediate and free and requires no extra tools, and bottle feeding requires you to have to prepare the milk and sterilize the bottles, so it just adds a few extra steps. And not to mention, formula can be really expensive. So to jump right into some of the benefits of breastfeeding, children that breastfeed are correlated to lower rates of obesity, diabetes, cardiovascular disease, and other metabolic diseases. Studies also show there's a correlation between cognitive and physical function in children that are breastfed. So this would include their IQ and their fine and gross motor skills. Breast milk is also perfectly composed of all the macro and micronutrients that your baby needs. So this would include protein, fat, and lactose. And there's also thousands of bioactive molecules that help protect the body against inflammation and infection. This is the most powerful tool in developing a maturation of the immune system that protects against all different kinds of diseases and illnesses. And those benefits really stay with the baby for the rest of their life. There's also a correlation between reduced allergies in children that are breastfed, and breastfeeding also supports organ development. There are literally dozens of living leukocytes and antibodies that are found in breast milk, and this helps support the immune function of your child. So there are also lots of benefits for moms as well as the babies with breastfeeding, some of which being a lower risk of certain cancers like breast cancer and ovarian cancer, a lower risk of osteoporosis, lower risk of postpartum depression and hemorrhage, which is excessive bleeding, and a lower risk of cardiovascular disease, including high blood pressure. Exclusive breastfeeding is recommended by the American Association of Pediatrics and AWON for a baby's first 6 months of life, but benefits of breastfeeding continue on much longer than that, up to a year and even multiple years of the child's life. From my experience, I can see that breastfeeding creates such a beautiful full circle bonding experience between moms and their babies, and not to mention it's completely free and such a special experience to get to share with your baby. Now I would love to demonstrate for you all my favorite swaddling technique. This is definitely the easiest and most effective way to swaddle your baby. This is not a very common way of swaddling, but I promise you it's the easiest way. And every time I've shown this strategy to parents, they always say, "Oh my gosh, this is so much easier. I'm so glad you showed us." I like to call it the Russian swaddle because a Russian grandma taught me how to do this. So with this swaddle, you're always going to use 2 blankets stacked one on top of the other. And with this one, you just leave them as a square. You're not going to fold over the tip into a triangle like they usually show you. And you're going to put the baby right at the top. You want it level with, the top of its neck. And you're going to do 1 layer at a time. So usually the baby's going to be moving around quite a lot, They're pretty aggressive with their arms and legs, so you're usually going to have to brace as you go. In the first move, you're going to take the first layer and you kind of do a downward angle across the baby's chest, and notice how I hold the arms down as I do this. And the arms you want pretty tight, so you usually have to hold in between. So we're thinking about a downward angle here and making sure you're holding the arms in place. You're going to grab the other one and pretty nice and firm and hold it here. And next you're going to bring the bottom of the blanket up. And this part doesn't have to be anything pretty or fancy. You're just going to kind of leave it at the baby's sides. And then for the next layer, you do the same thing. Downward angle, nice and tight. Downward angle, nice and tight. So you want to make sure you're not leaving a bunch of space, because when you leave a bunch of space, they're able to break their arms out, which is not a huge deal, but this will keep them feeling the most secure and warm. And also the baby's nails can be kind of sharp and they can scrape their face if their arms are out in front of their face too much. And then with this final step, you bring the bottom up. And what's so cool about this swaddle is in this final stage, you can tuck the blanket all the way around the baby and then even tuck it in. So it holds it in really nice. And the bottom can be quite loose. It doesn't have to be super tight. That way they can move their legs around as they need to. And swaddling is a great technique for soothing the baby if they're fussy. It just helps them feel warm and secure. So that is how you do my favorite swaddle, the Russian swaddle. So thank you so much for tuning in. I hope you learned lots of good information. And if you have any questions at all about anything that I covered, please do not hesitate to reach out and ask via email. I'm here to continue to support you, and let me know how your breastfeeding journey is going. Thank you so much. Have a good day.